Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We'll be speaking with Dr. Danielle Zerr. She's joining us as Medical Director of Infection Prevention at Seattle Children's to talk about the expected severe shortage of infectious disease specialists over the next decade. She'll talk about why this shortage matters, some of the challenges in the profession, why she has devoted herself to the infectious disease prevention profession, and some of the benefits of choosing this specialty. Welcome to Health Professional Radio. Dr. Danielle Zerr, thank you for taking the time.
Thank you. I'm happy to be here.
Tell us a little bit about yourself and your role at Seattle Children's, if you would.
Sure. I'm an infectious disease provider at the University of Washington and Seattle Children's Hospital. I'm the division head for pediatric infectious diseases, and I'm the medical director for infection prevention.
Was pediatrics your first love when you went into medicine?
Absolutely. Yeah, there's, nothing like taking care of kids. They were incredibly inspirational.
Projections by the Federal Health Resources and Services Administration says there's going to be a serious lack of professionals in the infectious disease space. Is this shortage going to be a result of the pandemic, or is it going to happen regardless of whether a pandemic happened or not?
Yeah, I think it has been in the works before the pandemic, and the pandemic is very likely going to make it worse.
What are some of the findings as to why this particular specialty is going to see this shortage or is experiencing this shortage now?
The thinking is that it's a combination of relatively long work hours, low salaries, and burnout. And in terms of the long work hours, infectious diseases is really time intensive. A lot of time is spent obtaining detailed histories, reviewing medical records, and discussing a patient's case with other disciplines like the microbiology lab and physicians and other specialties. And the pandemic has increased this work level over the last few years. And this, in combination with relatively low salaries, which we know about from surveys that have been performed, which show that infectious disease physicians are really amongst the lowest paid of specialties. Top paying specialties earn on average more than twice that of infectious disease docs. So this combination of long work hours, relatively low salaries, I think has led to a higher rate of burnout, which we know about from other surveys showing that infectious disease docs are amongst those with the highest rates of burnout. This combination is not good. So you can imagine trainees, when they see ID docs working, routinely long hours for lower compensation, that they will choose a different specialty, especially if they have, hundreds of thousands of dollars of educational debt. So as the numbers of ID docs drop in the field, this is just going to get worse, and that's really the concern, is that we would be on a very negative sort of spiral.
It would seem to me, someone not in the medical profession, that an infectious disease specialist would be compensated more simply because they have to deal with more details of illnesses due to the prevalence of infectious disease.
Yeah, I think it's a really good point. I mean, that makes sense to me, but I think in reality, insurance companies pay less for this sort of cognitive work, like history taking and chart review, compared to procedural-based work. And the profession is just not seen as a profit driver for hospitals.
What should we be on the lookout for when it comes to the availability of infectious disease specialists?
Yeah, I think if we look at the modeling that's been done by HRSA and others, we expect it to get worse. And unless some steps are taken to reverse the trends, especially given what we've seen with the COVID pandemic, we might expect it to be even worse than their projections. And this is a big deal, I think, because it really does matter for patients. The infectious disease docs take care of all different kinds of patients. The everyday work of infectious disease doctors is to diagnose and treat patients who have complicated infections. And studies have shown that the involvement of ID docs in the care of patients who have infections like bloodstream infections improves patient outcomes, increases survival, and decreases complications. And I want to stress that this this isn't specifically, for instance, COVID-19 infected patients, but all kinds of patients. So patients who develop serious infections in the community, or patients with cancer who develop an infection, or patients who have surgery and develop a severe infection. All of these kinds of patients can potentially benefit from the care of an infectious disease doc. And infectious disease docs also play roles in hospitals to ensure, for instance, that antibiotics are used appropriately, and this is called antimicrobial stewardship. And those teams work to ensure that antibiotics are not only overused, but are used appropriately, so that if a patient has a given infection, this team checks to make sure that they're on the right antibiotics so that they can get the best outcome. And similarly, ID docs also help in hospitals with preventing infections, working to prevent those healthcare-associated infections that can be so impactful to patients.
Was there any indication that some of the specialties within infectious disease were experiencing shortages in specialists and staff over others, say pediatrics over geriatrics? Was there anything like that discovered?
It's a great question. What was seen in the most recent national residency matching program showed that this is where the residents are matched with what training program they'll go into. And what we saw in the most recent match was that only 56% of adult programs and 49% of pediatric infectious disease training programs were filled, whereas most other specialties filled 90% or more of their programs. Most of the shortage that we're seeing now is concentrated in rural areas.
What do you say to the medical student about some of the benefits of being an infectious disease specialist?
Yeah, infectious diseases is really a fascinating area of science and medicine. The landscape is constantly changing, and it requires that you're always learning. The work is not static, and I think that is something that a lot of people find deeply satisfying. And then within infectious diseases, there are different directions you can take your career. Like you can be a clinician, or you can be a researcher. You can work in antimicrobial stewardship or infection prevention, administrative areas in hospitals.
Give us some websites where our listeners can learn more.
Sure. The Infectious Disease Society of America website has some great information on this issue.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Danielle Zerr. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to our YouTube channel at youtube.com/healthprofessionalradio.